When lower back pain strikes, most people simply wait for the problem to resolve on its own. However, you can get rid of the pain much faster if you apply the right treatment to your lower back. This set of special gentle exercises will help you quickly eliminate pain sensations. Forward and backward bends. Starting position. Stand up straight, feet slightly wider than shoulder width apart. Knees slightly bent for stability, hands on your waist. Keeping your back straight, slowly bend backwards without tilting your head back. Return to the starting position, then slowly lean forward. Keep your back straight the entire time. Return to the starting position again. Do 5 to 10 forward and backward bends. Pay attention to sensations in your lower back. If you feel discomfort, reduce the range of motion. This exercise effectively relieves tension causing pain. It also activates and strengthens the deep lumbar muscles that stabilize the spine. Side bends. Starting position. Stand up straight, feet slightly wider than shoulder width apart. Knees slightly bent, arms relaxed. Take a breath. As you exhale, slowly bend to the left, keeping your arms relaxed. Let your left hand slide freely down your thigh. Inhale as you return to the starting position. As you exhale, do the same bend to the right. The spine should only flex sideways. Inhale as you return to the starting position. Do 5 to 10 bends to each side. This exercise is great for stretching and relaxing the intercostal and oblique abdominal muscles, as well as improving spinal flexibility. Why shouldn't you bend over with a rounded back? When we bend over and round our back, we disengage the muscles that provide stability to the spine. At this point, all the strain falls on the ligaments and tendons, and the intradiscal pressure in the lumbar spine doubles. Over the years, this leads to vertebral instability, misalignment, disc problems, and pinched nerves. Therefore, whether you're working in the garden, lifting groceries at the store, or just tying your shoelaces, bend with a straight back by hinging at the hip joint. This simple habit will help you avoid spinal injuries. Topu Koran. Starting position. Stand up straight, with your feet shoulder width apart. Cross your arms, using your right thumb and index finger to gently grasp and squeeze your left earlobe. Similarly, use the fingers of your left hand to grasp your right earlobe. Take a deep breath in through your nose. As you exhale, gently squat down. Keep your back straight and knees pointing forward. Inhale as you rise back to the starting position. Exhale and squat down again, and so on. Do 5 to 20 squats. Start with shallow squats and increase the range of motion as your condition improves. This exercise strengthens back muscles, improves posture, and helps relieve pressure on the vertebrae and joints. The unusual technique of grasping your earlobes during squats serves a purpose. Psychologists studying the effects of the Topu Koran exercise on volunteers found that it improves attention and reduces anxiety levels. Child's pose. Sit on your heels, bend forward, and stretch your arms out in front of you. Place your forehead on the floor and relax your back. You can place a pillow under your stomach if needed. This exercise gently stretches the spine, relieving pressure on the intervertebral discs and joints. It's especially beneficial for the lumbar region, which is subjected to the most stress. Additionally, this pose relieves stress, which can also trigger spasms and lower back pain. Cat-cow. Starting position. On all fours, arms and thighs perpendicular to the floor. Back straight. As you inhale, arch your back and draw your navel towards the floor. Lift your head slightly, but don't tilt it back. As you exhale, tuck your pelvis, round your back, lower your head, pull in your stomach, and try to press your navel towards your spine. Slowly repeat the exercise 5 to 10 times. Cat-cow improves flexibility in the neck, shoulders, and spine, and stretches the muscles of the hips, back, abdomen, and chest. Healthy back. Starting position. Lie on a flat surface. Bend your knees. Place your feet on the floor, hip width apart. Arms at your sides with palms facing the floor. Take a breath. As you exhale, slowly press your lower back into the floor using your abdominal muscles. The lower part of your pelvis should lift slightly off the floor. As you inhale, relax your abdomen, allowing your lower back to return to a neutral position. Repeat 10 to 15 times. Perform the movement smoothly, without rushing. This exercise warms up and tones the muscles of the lower back and pelvis, strengthens the abs, and improves spinal mobility. Hamstring stretch. Lie on your back. Bend one knee with your foot on the floor. Extend the other leg upward, grasp it just below the knee with both hands, and gently pull it towards you. Repeat the exercise for the other leg. Do 5 to 10 sets for each leg. We are now relaxing, stretching, and toning the hamstring muscles that attach to the pelvis. Tension in these muscles is a common cause of lower back pain. Now, wrap your arms around both legs simultaneously and pull them towards you. Hold this position for 20 to 30 seconds. Spinal twist, starting position. Lie on your back, arms outstretched to the sides, legs together and bent at the knees. Feet flat on the floor. Lower both knees to one side while turning your head to the opposite side. Keep your shoulders on the floor. Hold this position for 20 seconds. Repeat the exercise, bending to the other side. Gentle twisting movements relieve tension from the muscles supporting the lower spine, as well as the quadratus lumborum and piriformis muscles, whose spasms often cause pain. Twisting also improves mobility in the spine and hip joints, which helps prevent future pain. Bridge pose. Starting position. Lie on your back, knees bent, feet flat on the floor, hip width apart. Lift your pelvis upward, supporting yourself on your shoulders and feet. Hold this position for 10 seconds, then slowly lower back to the starting position. Repeat 5 to 10 times. The half bridge relieves tension in the thighs and buttocks, strengthens them, improves blood circulation in the lower back, helps speed up tissue repair, and reduces inflammation. Additionally, this exercise strengthens the internal obliques. External oblique abdominal muscles gently works the back and improves posture. Why is it important to strengthen your back muscles? Normally, the core muscles and deep muscles adjacent to the spine should stabilize it, holding all of its structures in place. But what happens when a person is not physically active? The spine's stabilizing muscles weaken, lose tone, and then the entire load falls on the ligaments and tendons, which, unlike muscles, wear out quickly. This is why physically inactive people eventually develop problems with their vertebrae, discs, and nerve roots. Shavasana, starting position. Lie on your back, arms extended and slightly away from the torso, legs straight and shoulder width apart. Close your eyes. Relax your entire body. Breathe naturally and try not to think about anything. Stay in this position for 5 to 10 minutes. Extend your arms above your head. Stretch your whole body, from your hands to your feet. Roll onto your side and slowly stand up. Shavasana relieves muscle tension, reduces stress and anxiety, normalizes emotional state, and increases overall body tone. Do this routine every day, and you will forget about lower back pain once and for all. Special instructions. Listen to your body. If pain increases during any exercise, temporarily stop doing it. With acute lower back pain, any sudden movements can worsen the condition. Move smoothly. Avoid jerky movements. If acute lower back pain is a result of injury, spinal pathology, or nerve root issues, It's recommended to consult a specialist beforehand.
This content is for informational and educational purposes only. Consult with a doctor or healthcare professional before following any recommendations provided in this video. Tell us about your experience in the comments and subscribe to our channel.